Now, our next topic is panic attacks and generalized anxiety disorder. So, we are done with depression. Now, we are going to discuss some anxiety disorder. The main feature of depression was everything will be low. Low mood, low interest, low energy, low appetite, low sleep, everything will be low. Now, in panic attack and in generalized anxiety disorder, the main complaint will be anxiousness, and constant worrying. Constant worrying about everyday events such as money, expenses, children, job, etc. So the main complaint in panic attacks and in generalized anxiety disorder will be excessive worrying about everyday events, and along with these main complaint, other symptoms, physical symptoms such as palpitation, sweating, tremors, SOB, it can also be present. If the features are recurrent and short-lived, then we'll say it's panic attack. And if the symptoms are constant and they persist throughout the day, weeks and months, then we'll say it's generalized anxiety disorder. So panic attack is period of intense fear characterized by palpitation, sweating, tremor, SOB that develop rapidly. It peaks around 10 minutes and then gradually settle down and resolve over the next 20 minutes. Extreme panic attack. In extreme panic attack, a patient feels that he is going to die because of palpitation, sweating, tremor, and SOB. The patient thinks that he has a heart attack or he has a cardiac problem or a respiratory problem due to which he is going to die. So he may complain of sudden severe, sharp, stabbing chest pain as well. Then how you are going to differentiate this from a myocardial infarction? Remember that in the scenario or in the question of panic attack, it will be mentioned that ECG and cardiac enzymes are normal, or all the investigations that are done are normal. So the presentation of panic attack is similar to myocardial infarction. The difference is that the investigation will be normal in case of panic attack. Similarly, you all know that pulmonary embolism can also, panic attack can also mimic the features of pulmonary embolism. That is tachypnea, chest pain, tachycardia. So these are the features of pulmonary embolism as well. Again, in pulmonary embolism, partial pressure of oxygen will be low. While in case of panic attack, partial pressure of oxygen will be normal. During a panic attack, hyperventilation lead to washout of CO2. So there will be respiratory alkalosis, and respiratory alkalosis will cause hypocalcemia. And the patient will have a tingling sensation or perioral paresthesia as well. So there are physical symptoms in panic attack. But again, to differentiate it from other conditions such as MI and pulmonary embolism, you need to look at ABGs and ECG and oxygen saturation, etc. So in the question of a panic attack, all the lab investigations such as FBC, KFT, CXR, they will be normal. And if a panic attack usually resolves within 20 to 30 minutes. So if a panic attack persists beyond this time duration, then you need to rule out other causes by doing a CXR, chest X-ray, or ECG. etc. Now, what is the management of panic attack? During acute episodes, simple breathing exercise is done. That is breathing through nose and paper bag, and ask the patient to slow down breathing, and reassurance is all that is needed. So because the main problem in panic attack is hyperventilation that lead to respiratory alkalosis. So during acute episode, simple breathing exercise such as breathing through nose or breathing into a paper bag or slowing down the breathing or reassurance is all that is needed. While the prophylactic treatment for panic attack include SSRI such as sertraline and fluoxetine and CBT. So CBT and SSRI was the treatment in depression, and it is the treatment that is given to prevent further attacks, further panic attacks as well. So for the prevention of panic attacks, CBT and SSRI, for acute episode, breathing through nose or breathing through a paper bag and reassurance, and panic disorder during a specific time period or during an upcoming event, then we will give propranolol. For example, if the patient need to go to a stage and make a speech, and he want to prevent a panic attack during this event, then we will use propranolol. So to prevent attack during an upcoming event, propranolol. For acute episode, simple breathing exercise, and to prevent panic attack, CBT and SSRI. Now, generalized anxiety disorder, again, uncontrollable, long persisting feeling of anxiety, stress, palpitation, worrying about everyday events. So a constant feeling of all these things, your diagnosis will be generalized anxiety disorder. Other features, they may also include tachycardia, palpitation, restlessness, irritability, muscle tension, sweating, breathing difficulties, chest discomfort. So the symptoms of panic attack and generalized anxiety disorder are almost same, and the management is also same. That is CBT and SSRI. The difference between panic attack and generalized anxiety disorder is that the symptoms are long lasting in GAD while they are short lived in panic attacks. The symptoms in GAD are present nearly all the time, while the symptoms of panic disorder, they are episodic and sudden. Now let's do some example. A 40-year-old female presents complaining of sweating, palpitation, restlessness almost throughout the day for the last 1 year. So these feelings, they are present every day for the last 1 year. So it is generalized anxiety disorder because the symptoms are not episodic. She is irritable and has difficulty to concentrate. She thinks about everyday events. She also has occasional chest discomfort and shortness of breath. So sweating, palpitation, restlessness, chest pain, shortness of breath, these are all the symptoms of panic attack as well as generalized anxiety disorder. The only way to differentiate between them is the duration of the symptoms. Because these symptoms are present continuously for the last 1 year, so it is generalized anxiety disorder. It is important to note that generalized anxiety disorder is different from social phobias. Social phobia is also known as social anxiety disorder. What is social phobia or social anxiety disorder? There is a difference between generalized anxiety disorder and social anxiety disorder. In generalized anxiety disorder, the patient is anxious in general or all the time. While in social phobia or social anxiety disorder, the patient try to avoid certain situations such as meetings, group events, public speaking, eating in front of people, because they are afraid they will be criticized or embarrassed. So if a person become anxious in a certain situation, such as during meetings, during group events, during public speaking, and during eating in front of the people, then we'll label it as social anxiety disorder and not generalized anxiety disorder. Because the anxiety occurs in only specific social circumstances. So panic disorder or panic attack, generalized anxiety disorder, and social anxiety disorder, they are three different things. For example, a 30-year-old woman develops palpitation and dizziness whenever she is in a meeting. So palpitation and dizziness, these are the symptoms that are present in panic attack, in generalized anxiety disorder as well. But the only clue towards social anxiety disorder is that she develops these symptoms whenever she is in a meeting. So a specific social event or social circumstances that lead to the development of these symptoms. So the diagnosis is social phobia or social anxiety disorder. The treatment is like GATE, that is CBT and SSRI. So in short, anxiety disorders can be classified into continuous anxiety and episodic anxiety. Continuous anxiety is generalized anxiety disorder. Episodic anxiety can be in any situation, sudden in onset without any reason. That is known as panic disorder or panic attack. And episodic anxiety in a defined situation is known as social anxiety disorder or phobic anxiety disorder. Now, the phobia can be social phobia, it can be agoraphobia, and it can be simple phobia or any specific phobia. Now, what is phobia? Phobia is strong fear or dread of a thing or an event which is out of proportion to the reality of the situations. For example, agoraphobia means fear of public and open places, fear of traveling in buses, fear of visiting a shopping mall, fear of even leaving the house. So phobia is basically a type of episodic anxiety disorder that a person or a patient feel anxiety in certain situations or at certain places. So if someone has a fear of public and open places and fear of traveling in buses, fear of visiting a shopping mall, fear of leaving the house, then this is known as agoraphobia. What is claustrophobia? Claustrophobia is fear of confined spaces or being trapped. What is the management of different kind of phobia? The management is graded exposure to reduce fear response. Now, what is the difference between panic attack and panic disorder? Panic attack is a discrete episode of intense fear and physical symptoms such as tachycardia, palpitation, sweating, chest pain. So a discrete episode is known as panic attack, and recurrent panic attacks without any cause or out of the blue without any triggers, then it will be known as panic disorders. So more than one panic attack or multiple or recurrent panic attack if they are present in a person, then we'll label it as panic disorder. So this was all about different types of anxiety disorders and their management. I hope it's clear to everyone. If there is any confusion, you people can ask.
So the treatment of panic disorder is the same as panic attack.
Yes, it's the same. In acute attack, uh, breathing exercises and reassurance for the prevention of attack, CBT and SSRI, and to prevent panic attack during a certain situation or an event, we'll use propranolol.